Here in New England, the summer months are really welcomed. We finally get a chance to get outside and not have to dress in all those layers. Maybe get out and do some yard work or hike some of the trails. The thing we often forget about when we're out enjoying ourselves is that there are ticks out there lurking in the high grass and the heavy brush. With the cases of Lyme disease on the rise in recent years, we thought we'd speak to a few professionals to give us some tips on prevention and awareness so we can continue to enjoy the rest of this summer tick-free.
Whether you're going for a hike in the woods or just doing some work in your yard, ticks are out there, and these little bloodsuckers from the arachnid family can give you Lyme disease, something that's been on the rise in recent years. Of course, this doesn't mean you need to be terrified and hide out inside your house all summer. It just means you need to be aware of your surroundings and know what to do in the event that you get bitten by a tick. We spoke with a couple of experts in the field to give us the ins and outs of tick-borne disease. First, we met up with Melissa Silverman, a registered nurse interning with the local Board of Health working with Duxbury.
We're trying to teach residents that we have to protect ourselves in our own backyard, and we can do that through numerous ways. The list can go on, but basics are, mowing your grass regularly, keeping it nice and short, maintaining all your plants, your vegetation, so it's not too high. And there's certain, of course, plants that we want people to learn that it might be better if you have a deer-resistant plant versus a not deer-resistant plant. Moving bird feeders away from your yard is huge because that can attract rodents and wood piles. We want that stacked neatly away from the home. The goal is to not attract these rodents that could be carrying these ticks.
As it turns out, the black-legged tick, or deer tick, doesn't naturally carry the Lyme disease pathogen from birth.
And during a tick's life stage, they are born free of disease pathogens. And through the ticks biting rodents or small mammals, they can acquire this pathogen through the bite of the infected mammal or animal. Through the course of the tick's life, they can now transmit that disease to another host, human or animal.
Next, we stopped over at South Shore Medical Center in Norwell to speak with Chief Clinical Officer Dr. Nalband about the symptoms.
The symptoms from Lyme disease are many and varied, and they can be rather nonspecific. They can be sort of a flu-like illness. You can have chills and a fever, headache, arthralgias or joint aches. So it can be rather nonspecific. The rash is the most specific thing. If you develop what's called erythema migrans, which is a red rash, it's sometimes described as a bullseye rash, but most of the time it isn't a bullseye. The bullseye meaning that there's some central clearing in the rash, but usually it's just a red rash. It can usually start out by being maybe a couple of inches in diameter, but it can be as much as 2 feet in diameter. It can be a huge red area, or you can get multiple areas as the disease becomes disseminated.
If after being outdoors you do end up with a tick bite, Dr. Nalband says if you get to it within 36 hours, it generally doesn't require any medical intervention. But in the end, an ounce of prevention is worth a pound of cure.
The biggest thing, I think, is prevention, and I think that people awareness. I think you know that if you live in Massachusetts, you're in an endemic area, and I think that you need to take precautions when you're outside. Make sure that when you go inside, if you just wash off, if you make sure that you've examined yourself for any ticks and remove them, using DEET, at least 20%, wearing protective clothing, tucking in your pant legs into your socks, that kind of thing to prevent any ticks from getting on you. It's really about prevention. And then awareness. Once you have a bite or you have a tick, getting medical attention. If you go early and you can just get a single dose of doxycycline if you're in that window that I talked about where it's 36 to 72 hours, that will take care of the disease.
Melissa Silverman is hoping that awareness will lead to prevention.
I want them to get a knowledge base of the seriousness of ticks, how common ticks are in our area, and what personal protection measures people can start doing if they haven't already started doing it.
Hiking in the woods on the South Shore, I'm Brian Sullivan, PACTV Community News.